This is related to that.
A little bit.
The long haul term is kind of a strange term, but basically what they noticed when people got COVID, most people would get better, but some people, the symptoms would drag out, and they would refer to them as having a long haul of it, a long version of it. And we'll be talking about that, but you might want to generalize your thinking about this as it being basically a spike protein problem, where the spike protein is causing ongoing issues. And the symptoms of long COVID and what you might think of as, COVID vaccine related problems as being pretty much the same, because they both are related to having the spike protein causing issues. Because the injections are going to produce more of the issues with very, very, very high levels of the spike protein, and it's ongoing, they tend to be more severe in people who've had the jab versus those who've been sick and not had the jab. But I've been surprised at how often it can be severe in those who are sick from COVID itself. Another interesting factor is the long COVID symptoms don't necessarily occur in those with the severe disease. What we've actually seen is, stereotypically, a healthy young female has a mild case of COVID and gets over it, but doesn't. They keep having symptoms. They think they're over it because the main symptoms are gone, but those are often the folks that have this long COVID issue when it's from the virus itself. But what are the symptoms we're talking about? Well, on the left side is kind of the short version of symptoms: fatigue, headaches, sleep difficulties, hair loss, not being able to smell, appetite being off, joint pain, trouble breathing, chest pain, cognitive dysfunction. On the right side is a little more detailed, and we're seeing more and more folks booking appointments to see us with these issues, and this has become fairly common. And I would say half actually know that it was from I'd say we're seeing more that are related to the injections. Half know that their problem is because they got the COVID injection, and the other half doesn't seem to be accepting of that fact quite yet. And occasionally I actually have to ask questions and ask, so when did you get sick? And they'll say when. When did you get the jab? A week, a month before that. And then they start making the connection. Some people do actually have problems months after the COVID injections. And the word vaccine is not really appropriate for this type of therapy. What they called COVID vaccines was actually a genetic therapy. Prior to 2020, the term for this technology was genetic transfer technology, GTT. This genetic transfer technology was basically taking a mRNA that was similar to the real thing but altered so it would stay around longer, and getting it into the cell and then getting the cell to produce something. Now, most of us had a lot of concerns about this early in 2020, and it was based on the fact that all the studies that had been done on this technology had failed. They had actually not been successful at all. And a lot of people were surprised that we were making statements about that so early, and the data was there. We knew that there was likely going to be some problems. And if you look at the spike proteins that are on the virus, if you think about it, if that can make you sick, how much more are we going to be asking for trouble if the cells start creating the spike protein and they start floating around and in fact getting other cells involved? And what's unfortunate is the length of duration of that mRNA that is in the shot encoding for the spike protein is months, maybe years. We actually don't know how long it lasts. We know it's way longer than was initially advertised. It was initially advertised to dissolve within hours and days, but that is not the case. The spike protein that's produced from this also has been shown to last a very long time. Over a year, we've seen spike protein in the body. Now, you can imagine that having spike proteins in your body that are known to be a part of the clotting process, if you want to kind of boil COVID down, it's a clotting disorder. What makes the lungs change their appearance and have trouble breathing is not pneumonia like bacteria. It's actually a clotting process where the lungs are not being able to exchange air. So you can imagine that if that's going on throughout your body, where you're getting some microclotting going on, that you would have some problems, and that's indeed what we see. There's also other issues that go on with this. One is that the spike protein shouldn't be there, so the immune system goes after it, and when the immune system goes after it, that creates a complex, which that reaction is very inflammatory and damaging. And they also incorporate the mRNA in this lipid nanoparticle, which is also highly inflammatory and damaging. So there's a bunch of angles for why the injections cause problems. Now, fortunately, the good news is that there's some things you can do about it. Intermittent fasting is useful because it stimulates autophagy, which is tearing down some of the proteins that don't belong. Things like low-dose naltrexone, ivermectin, nattokinase. So there's a long list of things that are useful. And basically, we have all of these at our disposal. And what we have found that the vast majority of people do respond nicely to this. It needs to be comprehensive and it takes some time, but there are absolutely some things you can do. Oh, we can sing songs about these. Methylene blue, if you're tired of boring urine, you can have blue urine. It's the mitochondria. What was that?
It's ruined my toilet.
It does make your toilet have a difficult time staying non-blue. And it is wonderful for the mitochondria. It makes, basically, it's used as an antidote in emergency rooms. If somebody's actually got a toxin, what methylene blue has this ability is to cycle electrons around the blockage so things keep moving. And so you go on, the electron transport is the process in the mitochondria that winds up making ATP, and it actually can produce energy even with the blockage in place. So that's a wonderful aspect of methylene blue. Nattokinase helps chew up the protein and reduces that aspect. Low-dose naltrexone, aside from ivermectin, might be the most powerful tool we have in the long haul post-jab problems. Ivermectin is often used temporarily for 1, 2, 3 months, and it's been found that often produces symptom relief the fastest. It's thought to bind the spike protein, and by coating, help remove it and prevent its damage. Of course, aspirin reduces clotting. Curcumin and bromelain helps break up the spike protein. Sirolimus, like intermittent fasting, it activates some of the same processes that intermittent fasting does and reduces inflammation. Melatonin is great at reducing inflammation, as is magnesium. And if you combine methylene blue and red light therapy, there's synergy. They both work at the mitochondrial level, and that can be really helpful. Like if someone has a lot of brain fog and they're taking blue and apply red light to their head, that can really be helpful at getting that part of their body working better. Or if they have terrible joints, it can be really useful. Probiotics, prebiotics are always important. Vitamin D, always important. You always want to take D with K2. And acetylcysteine supports glutathione, which helps with detoxification. There's actually some others, but this is the main list we work off of. So, and